Hi guys. Welcome back to RT Share Tea, where respiratory therapists live out loud with me, your host, Linda Fry, the Asthma Lady. Yes, thank you so much, guys, for coming back to listen to more tea from the Asthma Lady. Thank you to my newcomers. Thank you to anybody that's been supporting me and sharing the content. It's been a great ride so far. So hang in there. We have so much more to come, and know that we are growing together. Okay, guys. So yes. Oh yeah, so I'm coming back from some travel. So I didn't come on last week. I was in the ATL. I was in Georgia for a friend's wedding. It was fabulous. And I just needed a little break. And so we're here today, and I won't be on next week as well. So I will be away in Vegas for Father's Day. I'm taking my husband to Vegas for Father's Day. Ain't I a good wife? Okay, so we just getting these little vacations in while we can, right? Life is very hectic, but we are blessed to be able to travel in times of uncertainty and complete and utter chaos. But we out here living our best life as safely, that is. Okay, so all right, so yes, please remember to like, share, and subscribe to us on Google Podcasts and on YouTube. We are on Google Podcasts every Wednesday at 6 p.m. Eastern Time, and we are on YouTube every Thursday, except for next week, because like I said, I'll be in Vegas living my best life. All right, so moving on. Okay, so in this episode, we're going to talk about MDIs versus DPIs. So when it comes to asthma medications and treatment plans. So pretty much, okay, so the last couple of weeks I spoke about motivational interviewing and pretty much getting the information necessary from our patients in a way where they are actively engaged and we are getting all the clues to help manage their asthma. And the week prior to that, I also spoke about using the inhaler with spacers to help with inhaler technique, and making sure patients get all the medication. So this is just to kind of piggyback off those topics as far as in relations to asthma education, right? So I get this question a lot when I do presentations and I present on asthma medication devices. So that for those of you who do not know that, and who do not come from this life, right? There are so many devices out there when it comes to breathing treatments, and so for your COPDers and for your asthmatics. Okay, so there are. I was on maternity leave and for like 6 months, and I think like 2 to 3 more medications came out. And so there's so many options now versus just an inhaler, a regular inhaler. So what I'm gonna do is kind of just walk you through a few. I know some folks listen to me only on the radio, so it's a little harder, but I'm showing right now the discus right now, which is the round device, and this is usually where our Advair would be, or something like a Ceravent, right? So what a lot of providers tend to do is sometimes when they are not a pulmonologist, or if it's just a regular PCP, they're not a specialist, they go with a one size fits all. It's like, okay, they know Advair, so they stick to this device. Now what a lot of folks don't know is that every device has its pros and its cons. So it's asthma management is not a one size fits all. Like you have to literally tailor it to the person, and that goes for the medication and the devices that we choose for each patient. Whether it's the age bracket, or can the person physically use this medication or the treatment plan that you're trying to teach them, or the one that the provider chose, right? So what you have to know is that for an MDI, to use a regular inhaler, right? Let me see if you can see this. To use a regular inhaler, so for this, you need a peak inspiratory flow of negative 30. All right. So that means you need to be able to inhale to that level of degree to get the complete medication. Right. So I already spoke about, the spacer with our MDIs, so we are a huge advocate for using the inhaler with a spacer. Okay. So this is what we always encourage patients to do when they have an inhaler. But know that when it comes to a DPI, a dry powder inhaler device where your Advair would come in, this you need a peak inspiratory flow rate of negative 60. So what that means is you just need to be able to have to inhale deeper, like just take it in deeper. So sometimes you look at the patient. There are times when I look at the patient's order, the patient is 90 years old, and it's like, looking at the patient, I'll be like, I know for a fact the patient cannot use this device the right way. You know what I'm saying? But some providers, like we said, they just know one specific medication, and they write everyone the same prescription. You understand what I'm saying? So know that this, you need to be able to have a little more power to take the medication. So for those of you who don't know how to use a discus, so it looks like this. It has to be held like a hamburger, like pretty much like a sandwich, a hamburger. You put your finger on this slide. Here is the mouthpiece. You see that? So when you click this little lever here, the medication has been dispersed. So it's waiting for the patient. So literally, like I said, they hold it like a burger. Now, you have kids who are on this, like, maybe a preteen or a teenager, and it's like, hey, Peter, did you take your medication? Yes, Mom, I took it already. All right. So it's in their hands and whatever. They lost the medication. It's gone. So know that once you do this, this is over. And so we get a lot of times patients say, like, listen, I don't feel like the medication working. I didn't feel anything. And what they don't know is if you don't hold it, what is this? Horizontal, right? Horizontal, right? If you don't hold it in this position, the medication is gone, right? And then they breathe out, empty their lungs, and then it is a fast and deep inhalation. So if they don't do that, they did not get all the medication. Okay, just know that. So know that the way I always try to remind folks for exams, like if you're taking the exam to be certified, you have to remember that your MDI is negative 30 and your DPI is negative 60. MDI negative 30, DPI negative 60. So just know the difference between the two, because that lets you know what device is appropriate per person. And know that your average COPD or asthmatic patient can do about roughly 40, like negative 40-ish, like negative 43 to negative 45. So these devices are genuinely appropriate. Now, like we said, it just comes down to the actual individual, and it also depends on the setting. So a lot of these devices, here's another one, your inhib device, which would be your Wixella, which is the generic for Advair. So this is another DPI device, so very similar, same thing. You press the lever, and the same technique I just showed you with the with the DPI. But once again, it's very dependent on the strength of the patient. If they're able to do it, be careful for the setting. We get providers who will say, okay, if a patient is in not like ICU or step down unit, patient is in pain or can't sit themselves up or anything like that, these devices are not for them. They're all low flow devices. But if the patient does not have the strength to do them, it's just not appropriate for that setting. So sometimes you might have to, as the educator or as the respiratory therapist, you just got to be, go check the order, and you might have to tell the doctor, listen, the patient can't use this device. It's just they can't do the effort to get the device. So you're wasting everyone's time pretty much. Okay? So that's pretty much it for today. I have so many of these devices, and a lot of people ask me a lot, where do you get these from? So these demos, they come from the pharmaceutical company. So what you do is you look up the medication that you need to teach the patient. So basically, whenever you need to teach a patient something, you yourself should know how to do it, right? So ideally. And so, these devices, these demos come in very handy. So you get them from the actual pharmaceutical company. You just reach out to them and you let them know that you're an educator or a clinical educator, and you need the demo in order to help patients out with education. All right, guys. So I hope you learned something from me here today, from Thee Asthma Lady. And know that we just gonna continue with this, and we will be talking about other topics. There's so many layers to the Asthma Lady. Okay, so we will be talking about other things coming down the road. All right, guys. So once again, please remember to like, share, and subscribe to us on Google Podcasts and YouTube, and anywhere else you could hear podcasts. I know I'm on several different platforms by now, and you can find me in any of those. So thank you so much for the support, guys. All right, guys. So, and I just want to say, remember to invest in yourself and to only compete with yesterday's version of you. All right, guys. See you next week. Bye. Oh, no, I won't be here next week. Matter of fact, I will see you the week after. Your girl will be in Vegas. Okay? All right, guys. Talk to you later. Bye.